Immediately a woman is older than a particular age, getting pregnant and attempting to have a baby becomes a threat to that person's life. So menopause is actually a normal protective mechanism for women when they are growing old.
It opens with a date of art. Moves into windows of creativity.
She finds the only English word she knows from somewhere deep in the belly of a 4'9" body, and instead of "I won't care," she reads us with "bye-bye."
Branches into rooms of color. And ends with a roof of imagination. Walk into Art House. The pieces all come together at 9:30 p.m. every Saturday. Art House, life is art.
As the doctor said, menopause is not a state of disease. It's a natural stage or milestone for every woman. Do keep that in mind. This will lead us into other headline stories on our news segment.
The teachers are being trained, but the training...
Disability is the consequence of an impairment that may be physical, cognitive, mental, emotional, developmental, or some combination of these, which may be present at birth or occur during a person's lifetime. But the question is, what went wrong? Finding the answer to this and so many other questions relating to disability is what informed this gathering of medical practitioners, parents and persons living with one form of disability or the other in Lagos. While identifying accidents, birth injuries and congenital defects as some of the risk factors for disabilities, experts from various fields advocate for better care for persons living with disabilities through the retraining of health workers, teachers, guardians, and also government and corporate funding of existing centers.
Impairment they have is imposing a kind of limitation on their performance. It could be in the area of education, it could be in the area of social, it could be in the area of even locomotion and some other areas like that, speech and many other things. People with special needs, they have right to life and to every other thing a normal individual is having. Therefore, what parents, teachers, government, and society will have the right to give them all that they need to make them to survive in the society. And when they need acceptance and empathy on our part so that they can be accommodated into the society. And these people, they can live a normal life if only we can give them all the necessary support that they need.
In terms of policy from the government, what the federal government needs to do right away is to sign the disability bill into law. That is the first thing they need to do at the federal level, to ratify the Convention on the Rights of Persons with Disabilities, which guarantees the rights of persons with disabilities to healthcare, education, and a decent life in all aspects, without discrimination, without any impediment, and without making a big deal out of it, either by charity or philanthropy. You understand what I'm saying? By law, it is the right of every child, whether disabled or not, to have access to these facilities in life.
Pharmacists under the aegis of the Association of Community Pharmacists of Nigeria, ACPN, have applauded President Goodluck Jonathan's administration on the approval of drug distribution policy for the country. At a media briefing in Lagos to highlight the national conference of the ACPN coming up from June the 3rd to the 7th in Calabar, the national chairman of the association, Mr. Adebayo Ismail, said Nigerians will only have access to safe medicines when the channel of drug distribution in the country are secured appropriately. He pointed out that medicines displayed or sold in awkward places such as markets could be injurious to health.
If NAFDAC can improve in the way drugs are brought in, let us have a tight border. Anything coming in, let's do appropriate tests on them. appropriate laboratory tests and make sure that things are done in the right way. By the time we do that, I'm sure pharmacists are professionals that won't want to partake in any shortcut in any form. Because we have been trained, we know the implication, we know what it takes, we know what it means, we know what drugs are, right from the synthesis till the thing is excreted from the body. That is the training of a pharmacist. And by virtue of that, we want to guide against we swear to an oath. So a pharmacist at that point in time, we want to protect that oath as much as possible.
Outside Africa, a new strain of coronavirus has claimed another life, this time in France. The French Health Ministry said a 65-year-old man who had been traveling in Dubai has died from the illness. He is the first French man to fall ill from the SARS-like coronavirus. The World Health Organization says the virus, which causes coughing, fever and pneumonia, can likely be passed between humans, but only after prolonged close contact. Out of 44 confirmed cases worldwide, 23 people have now died, with most of those infected having traveled in the Middle East. A virus from the same family triggered the SARS outbreak in Asia that killed 775 people in 2003. Still on viral infections, drug resistance has been detected in patients infected with the new bird flu that has emerged in China. Doctors analyzed the virus in 14 patients at the Shanghai Public Health Clinical Center. All had pneumonia and half needed ventilation to keep them alive. Treatment with antivirals reduced levels of H7N9 in most patients and led to an improvement in symptoms. Yet the treatment failed in 3 patients. Genetic testing of the virus in these patients showed it had acquired the mutation needed to resist the drugs. The researchers, writing in The Lancet, said resistance emerged with apparent ease and was concerning. There have been no new cases of the infection for more than 2 weeks. Since it was first reported earlier this year, there have been 131 confirmed cases and 36 deaths. And finally, on a sad note, 2 female workers in a polio eradication campaign have been shot in Peshawar, Pakistan, leading the World Health Organization to suspend operations in the restive northwestern city. Unknown gunmen opened fire on a polio workers' team and killed 1 female polio worker in Badabed in the outskirts of Peshawar. The polio workers' team had administered polio drops to children in 25 houses in the locality and were walking towards the 26th house when the incident occurred. Soon after the incident, police arrived at the site of the attack and cordoned off the area. The deaths are the latest in a string of attacks over the past few months that have partially halted the UN-backed campaign. No one has so far claimed responsibility for the attack, but Taliban militants have long been targeting polio immunization workers in the country. Last December, the United Nations and Pakistan pulled all staff involved in the campaign